welcome to the Global Anesthesia Development Partnerships Conference today. Thank you everyone for joining us. We've had lots of people signing up, so hopefully through the day there'll be over 100 people signing in. And I just want to say thank you very much to the Royal College of Anaesthetists for dealing with the IT and with Sonia and I trying to organise today. I'm going to start by introducing Dr. Dylan Bould. He's the Director of GADP. He's a Professor of Anaesthesia and Medical Education at the University of Ottawa and an anaesthetist at the Children's Hospital of Eastern Ontario. And he's going to be opening the conference today. Thank you very much, Dylan.
Thank you, Emma. Can you hear me okay?
Yep, we've got you.
Fantastic. Okay, so again, echoing Emma's comments, welcome to the GADP conference. I think we have some really fantastic speakers today from Zambia, South Africa, Ethiopia, and the UK. And I was really excited to see so many people register from all over the world. So I think that event is recorded later for those who will watch it later. I don't think there's quite as many people now in the participant list as there perhaps will be eventually watching this. But really kudos to Emma and Sonia and team for managing to get the word out so well, so that so many people signed up for this. It's quite amazing to see what started off as like quite a small annual day for our charity, focusing just very much on our own personal goals and projects, has become quite a lot bigger than that. Other thanks to David Murray at the Royal College for hosting this. And again, thank you to Emma and Sonia and team for putting the day together. I'd also just like to say some general thanks on behalf of GADP for all of the work during the year. And really, there are too many people to mention, but obviously thank you to our board of trustees, to our donors, to the volunteers who've been working in our programs, our admin support, Ava and Gwen, and to our many partners, but in particular to the Society of Anesthesia of Zambia and to the Ethiopian Society of Anesthesiologists. So just a little kind of recap for people on the call who don't really know who GADP is and who we are as a charity. We're the Global Anesthesia Development Partnerships. We're a fairly new charity in that we incorporated as a charity in the UK in 2017. But really, that doesn't tell the story of who we are as a group, because it's really the same group that's been building on some fairly long-term partnerships that formed in around 2010, 2011. So in 2010, we initially collaborated on the Zambian Anesthesia MED anesthesia residency training program that was partnered with the Tropical Health and Education Trust. ZADP, the Zambia Anesthesia Development Program, was set up in 2012 as an extension of this, and it originally was a partnership between the Department of Anesthesia at the University Teaching Hospital in Lusaka in Zambia and the AAGBI, the Association of Anaesthetists of Great Britain and Ireland. Since then, and due to the kind of cyclical nature of funding from DFID and UK aid, we made the decision to incorporate into a charity so that we could take a little bit more control over our own fundraising and how we did business. And we've since then had ongoing support of anesthesia training in Zambia, which has been the main thing that we've been doing through ZADP for these last 10 years or so. In more recent years, we've been working in collaboration with the Canadian group CASIEF to give support to anesthesia training in Ethiopia also. And the main model of how we work, which I think most of us on the call are very familiar with, is of partnership, focusing on bidirectional learning and benefit, both with our partners in Zambia and Ethiopia, but also our volunteers and trustees in the UK, Canada, Australia, who spend time in Zambia and Ethiopia and work alongside people. A very long-term time horizon where we're planning for the relationship in these partnerships to last for a decade or more, because it takes a really long time to help to create the kind of meaningful change that we're working with. And a focus on developing really meaningful relationships, educational, mentorship, collaborative relationships, and leadership developments. And I think that this model has been hugely successful, not just for us in our programs, such as ZADP, but also with other organizations that have used a similar kind of model. It's not always the easiest thing to get funded. It's definitely not the easiest thing to get grants for a kind of very, very long-term, perhaps vague sounding mission. But I think it's had a really, really huge effect. Since we had this conference about this time last year, obviously a lot of things have happened, and the world is a fairly crazy place at the moment. For context, I'd just like to remind all of us that all of the big issues in global anesthesia and global surgery that we have cared about were important to us and that were priorities for us with our programs and for our organization are still with us. So still, the majority of the world lacks access to safe, affordable, and timely surgical, obstetric, trauma, pre-hospital care. There's still a desperate shortage of anesthesia providers, especially physician anesthesia providers globally, and particularly in the poorest countries in the world and in sub-Saharan Africa. Issues such as maternal mortality, trauma, access to surgery for children with congenital defects are still dire, especially in rural areas of countries like Zambia and Ethiopia. And there's exactly the same need to scale up resources for global surgery as an indispensable part of a strong healthcare system that there was before we all started thinking about COVID and before the pandemic. And COVID has obviously added many, many challenges to these pre-existing issues that are still with us. Over the since our meeting, which was this time last year, we now have vaccines for COVID that we didn't have a year ago. Unfortunately, we also have vaccine inequity and vaccine nationalism. And around this time last year, I guess, a few people were being vaccinated, but it was only really healthcare workers and the most vulnerable in the population, mostly in North America. Currently now, most people in the world are vaccinated, with about 68% of Latin America fully vaccinated against COVID, and around 60% in North America, Europe, Asia, and Oceania. But still, only about 10 or 11% of the population of Africa, or sub-Saharan Africa, are fully vaccinated against COVID. Since this time last year, we've had travel bans related to COVID, and most recently due to the Omicron variant, which have been unequally and unfairly placed on different countries in the world, as much for political reasons as scientific reasons, and have been hugely damaging to some of the poorest countries in the world, as well as very, very challenging and obstructive for global health work and partnerships like our own. Very significantly, in the summer last year, there was the Delta variant and huge waves of Delta across different countries of the world. Perhaps most well known in the press was the devastating wave in India, but there was, I think, just as much damage done by the Delta variant in Zambia and Uganda and many other countries in southern other countries in sub-Saharan Africa. We heard from our colleagues that their healthcare systems were completely overwhelmed, and particularly issues with access to critical care and access to oxygen. Burnout, which was a problem before COVID, has become increasingly a problem as people have struggled to cope under the pressures of the pandemic. So I feel like one of my colleagues in Zambia said to me something that really struck me and really I thought was very impactful in terms of how the pandemic had affected her, when she said, since COVID, I've never felt so poor. That a lot of people see Zambia as a poor country, but she never really felt anywhere near so disadvantaged and so marginalized as a Zambian physician until the pandemic came and all of these things compounded each other. So I think it's increasingly obvious to us that it's essential to strengthen whole healthcare systems, and also how much that's been neglected historically and how much inequity there has, not just historically, but now has been compounded by COVID and the pandemic, which has really made these inequities a lot worse. It's been an incredibly challenging time for global anesthesia, global surgery partnerships, but I think it's also been increasingly clear how important those partnerships are, especially when seeing how vital, for instance, anesthesiologists are in countries like Zambia to maintaining the healthcare system, to providing critical care outreach, people who really know about oxygen supply and supply chains and cold chains are a really indispensable part of the healthcare system. And I think this potentially is an opportunity to advocate for the importance of our profession and the kind of things that we're trying to achieve. Despite this, I feel like our charity of GADP has actually been really, really successful over the last year. And it's been amazing to see so much resilience and adaptability from GADP. You'll hear a little bit more from other speakers through the course of the day of some of the different activities. But I just wanted to highlight a few things that I think have been particularly impactful and really important. The first is the buddy system, where we've paired up anaesthetists in Zambia with anaesthetists in other places in the world, really just to check in from time to time and to have a named buddy so that you can talk to somebody about what's going on in your part of the world, how you're coping with COVID, how you're coping with the PPE and the patient load and the workload and the stress and the burnout. Oh yes, sorry, there's a message in the chat. No, sorry, I don't have any slides. I just thought I would talk without slides. So you're not missing any slides if you don't see any. I think the buddy system has been amazing. I've personally found it hugely beneficial. I'm not sure about my buddy, but it's been fantastic for me. And I've heard from a lot of people that the buddy system has just worked so well, not just for having somebody to decompress with and somebody to talk to from our colleagues in Zambia, but actually also really useful for colleagues in places like the UK, who can talk about some of the troubles of working through this unprecedented, challenging time with COVID. We've distributed a huge amount of PPE throughout Zambia, throughout the whole of the country, to anesthesia providers countrywide in every single province, which I think is a huge achievement and has been really important for making people feel safe at work. There was the Take a Breath campaign over the last year, especially over the summertime when the Delta variant came, where we raised a huge amount of money from donations and some from grants to provide equipment to send over to Zambia, and to send some equipment sent to Ethiopia also. We sent over 50 oxygen concentrators, as well as oximeters and oxygen delivery systems, at a time when there was a desperate shortage of oxygen throughout Zambia and other places in sub-Saharan Africa. Teaching has been a real challenge. Our usual mode of operation is to have volunteers in country continuously year round, and have multiple volunteers. The GADP fellows and the ZADP fellows who are in country for 3 months or 6 months or sometimes longer have really been the foundation of what we've done. And at some points we've had 4, 5, even 6 fellows or volunteers on the ground in Zambia and Lusaka throughout the year, supporting the anesthesia program there through clinical teaching and classroom teaching, QI projects, and helping with research. And it's really been the foundation of our partnership over the past 10 years. It's been impossible to do that just recently, and we since we pulled our fellows out when the pandemic was declared, we haven't had in-country volunteers in Zambia. We've only just had a volunteer, Les Ababa, with the EADP program over the past few months. I think this has been really challenging. I think it's been a real challenge for our partners, but we've had huge success with remote teaching. And I think that like a lot of other programs, we've realized that there's an awful lot that we can do by Zoom, by remote teaching, that we will, I'm sure, continue when the pandemic is over, and will change the way that we run our charity and the way that we run our partnerships. Some things have been particularly successful. I think the exams have been fantastic, and perhaps a real example how well the exams have been for the Zambian anesthesia residency program have been run with support from GADP. And I've been told that they have been considered to be potentially an example for other countries in the CANEXA program because of how well they've run and how well they've been supported. We've also had some ongoing successes in fundraising and in the training of our board of trustees, and some thoughts about restructuring our board of trustees to make it a little bit more efficient. The other thing I'd like to say about the last year is just to also comment on the sad loss of Dr. Anthony Chisakuta, who was a friend and colleague for many of us who work with GADP. And his untimely death was truly tragic, and very much felt by all of us. For those of you who didn't know Anthony, he was an amazing person. He worked for a long time with the Society of Anaesthetists of Zambia, with our charity, with GADP, with Canexa, of which he was the chair of the education committee. He was the national lead for postgraduate anesthesia training in Zambia. An incredibly committed, selfless, wise teacher and mentor with a very kind and gentle humor, who, as I've said, was a dear friend, and a dear friend for many of us. And I think we're all still sad by his untimely death last March, and he's still sorely missed. Looking ahead for what the future holds for GADP as a charity over the next year, I think it's really hard to know what will happen with the pandemic. I think that we all feel that, and obviously none of us can predict the future. People are talking about the end game for COVID. In some countries, people are taking down restrictions, and I hear people tell me that they feel like COVID is over. I think for many places in the world, COVID is still very, very far from being over. And it's very difficult to know what will happen with the next variant and with the next booster, and to really appreciate how the situation will unfold. So I think we all realize there's a lot of uncertainty going ahead for all of us in our plans and goals and our partnerships. However, we really keenly anticipate the return of in-country volunteers to Zambia, which is planned for this August, and the continued support of in-country volunteers in Addis for EADP. I think that will make a huge difference, and it'll be, I think, challenging at first to make it work and to make it safe, but I think it's going to be really important to get things back on track. We're also hoping to somewhat restructure, as I mentioned, the board of GADP, of our charity, the board of trustees. We've had lots of discussions about this, and currently everybody on our board of trustees is an anaesthetist or an anesthesiologist, mostly from the UK and from Zambia. But we're interested in getting more people on our board of trustees with more diverse experience, who could potentially be from different places around the world, but we're interested in having people with skill sets outside medicine. In particular, at the moment, we're looking for a treasurer, somebody with a background in accountancy or finance, or dealing with money in one professional realm, who could help us as a volunteer trustee on our board of trustees, but really also interested in other people with diverse experience that would be useful for us, whether that's in a background in law or media or organization of charities or administration, as we try to turn GADP into a slightly more streamlined and professionalized board of trustees. So if you know anybody who might be interested in that role, then please share the word that we're interested in having new trustees on our board, and specifically people with expertise in those areas. So that's really all I wanted to say this morning. But again, thank you very much for your time. Thank you for registering for the meeting and for sharing the day with us. Very excited to be able to open and to then join the day and listen to all of the rest of the fantastic speakers today. And again, thank you so much, Emma and team, for arranging this.